How do you diagnose polycystic ovarian syndrome, or PCOS for short? Now, as the name suggests, PCOS is a syndrome, which means that it's a collection of symptoms, not a single symptom or a single blood test that can get you to the diagnosis. And the diagnosis can sometimes be a bit challenging because different women will present in different ways. And so, thankfully, we have some common guidelines that we agree on for the most part that can help us with the diagnosis. Now, the Androgen Excess in PCOS Society basically put down these guidelines, and they are as follows. So, if you have hyperandrogenism, is a very important symptom or very important aspect of PCOS. Hyperandrogenism refers to high androgens, which are testosterone, DHEA. You can also have high insulin levels because of insulin resistance. Okay, so something that can be measured in the blood, which is testosterone, DHEA, and insulin. And the DHEA is measured in the form of DHEA sulfate. That's why you may see the DHEA with an S at the end. And there can be signs and symptoms of these, which is acne, excessive hair growth in different places like chin, back, and so on, where we generally don't expect it to happen in females. That's something called hirsutism, is the technical term for that. So when you have these symptoms of high androgens, and or you have high androgens present in the blood, that's a very important characteristic of PCOS. Secondly, you can have irregular menstrual cycles or no cycles at all. And this is also a very characteristic feature, although not required. This is also a very characteristic feature of women with PCOS. And the third thing is polycystic ovaries, as the name suggests. So that means multiple cysts in the ovaries. Now, at the beginning of each menstrual cycle, there are multiple follicles, which are small fluid-filled sacs, and each of them contain one egg. And as the cycle goes on, if you have normal ovulation, each follicle should be growing and maturing for that egg to eventually be released through the fallopian tubes into the uterus, and that is the process of ovulation. When there is a problem with this process and it's not one follicle that matures, leaving the rest behind to kind of shrivel up, then you find that there are multiple follicles that grow in a really absent, cohesive, or organized way. And these multiple different follicles containing different eggs will then be present and can be seen in an ultrasound as a polycystic ovary. And this is on an ultrasound, the characteristic finding is called a string of pearls. You may have heard that on an ultrasound report. So it looks like a string of pearls. And while these essentially these cysts in the ovaries are not harmful in and of themselves, they are a manifestation of what's going on underneath, which is the problem of polycystic ovarian syndrome, which we talked about separately in a different video with what is the underlying mechanism of this. But the end result is multiple different follicles there and no one follicle maturing. And this actually leads to the biggest problem, which in PCOS, when you have infertility associated with PCOS, the biggest reason for that is usually due to a lack of proper ovulation as a result of the mechanism that I just mentioned. So when you have high androgens plus one of either the irregular cycles or no cycles at all, or the polycystic ovaries that you can see on a transvaginal ultrasound, you have the diagnosis of PCOS. And remember that it is a diagnosis of exclusion. And what this means is that you don't just arrive to the diagnosis right away. There are other tests that need to be done, such as prolactin levels, such as cortisol levels, things like that, just to exclude anything more rare, like an adrenal tumor, Cushing's syndrome, which is another adrenal related condition. Those need to be excluded before you can say that this is PCOS. But I think for a clinician like myself, I try and remain very vigilant when it comes to PCOS because of how common it is. So even though it is a diagnosis of exclusion, it's oftentimes important to have those radars on when talking to a woman about her symptoms and about her blood work. So that was a little bit about the diagnosis of PCOS. If you have any questions or comments, please leave them below. And if you do suffer from PCOS, I would love to hear about your experiences below.